Hi, I'm Josh Ratner, and welcome to Health Alliance and You, a health and wellness series brought to you by Health Alliance of the Hudson Valley. When you have a medical emergency, you want to get to the hospital fast, and you want swift, expert emergency care. The emergency department of Health Alliance Hospital in Kingston provides state-of-the-art, round-the-clock care 7 days a week. It's designed for speed, accuracy, and safety, and has some of the shortest wait times in the country. And its 24/7 care by board-certified emergency medicine physicians lets you know you're getting the highest level of care. Here to discuss this is Dr. Fareed, Medical Director of Health Alliance's Emergency Department.
So what is emergency medicine? Emergency medicine is a medical specialty recognized by the American Board of Medical Specialties. It was formally recognized in 1979, and therefore it is a relatively young medical specialty compared to others. And the essence of emergency medicine, its core body of knowledge, is the recognition, stabilization, and management of acute medical and surgical conditions. The body of knowledge in emergency medicine encompasses the emergencies of every other specialty. So an emergency physician who's board certified is trained in the recognition and management of every kind of emergency, whether it be an orthopedic emergency, cardiovascular emergency, neurosurgical, obstetric, ear, nose, and throat, etc. We have on call a broad array of specialists here at Health Alliance who we can call if we need them, but an emergency physician is trained in the recognition and initial management and stabilization of every emergency. So if there are very complex cases that require a specialist, we call a specialist, but the majority we can handle on our own. An emergency physician brings someone who can handle the emergency of every specialty into one person. All of our physicians are board certified by the American Board of Emergency Medicine and meet all of their requirements regarding professional standing, maintenance of certification, their examination requirements. It's a very rigorous process, as rigorous, if not more rigorous, as the other medical specialties. The reality in our healthcare system is, unfortunately, many people don't have access, and having insurance doesn't necessarily equal access in our country. And so we, in the emergency department, act essentially as the safety net of the healthcare system, and we're, in fact, very proud of that, that we take care of people 24/7, 365, and that's part of our training. And it's part of what we do day in and day out. Our emergency department sees on average 125 patients a day, which comes out to annually about 45,000 patients a year. About 15% of them go to our fast track, and on average are in and out the door in 2 hours. The remaining 85% are seen in our main ED and tend to be sicker. And the average time from arrival to discharge there, if you are discharged, is about 3.5 hours. If you're admitted, we get you to your bed in about 6 hours. We continually try to improve these times and benchmark them against national averages, and we do very well. We also have about 15% of our volume is pediatric, meaning under 18, and our physicians are fully trained in managing pediatric emergencies here. And our volume has been growing year over year, and I think that's a testament to the fact that we've become operationally better and clinically better as well. We have the latest in advanced airway equipment, including fiber optic airway. We have 2 ultrasound machines that emergency physicians use for bedside ultrasound. So, for example, in a traumatic arrest, we are able to make very quick diagnoses with this ultrasound at the bedside. We have the capability of instituting therapeutic hypothermia, which is basically cooling someone after a cardiac arrest with return of circulation to preserve their neurologic outcome. And so we basically have the latest in advanced emergency care equipment. I'd like people to know that basically we here at Health Alliance, we recognize that we are the primary healthcare system in Ulster County. We take our responsibility of serving the community very seriously, and in the emergency department, people should know that we are ready 24/7, 365 to take care of any of your acute care needs, whether it be something minor to something potentially catastrophic. We have outstanding physicians. We have operationalized the ED to a point where it is very efficient. We have a best-of-breed emergency medical record, so we can get to you quickly, take care of you quickly, and stabilize your condition. And so if and when you need emergency care, think HealthAlliance.
As you can see, at HealthAlliance, we take emergency medicine and our emergency department seriously. If an urgent medical condition ever comes up, it's better to be safe and go to the nearest emergency department that can treat all your needs. The state-of-the-art emergency department at HealthAlliance Hospital in Kingston treats more than 45,000 patients a year. It has teams of board-certified emergency medicine physicians, registered nurses, and other specially trained staff available at all times. They treat anyone seeking emergency medical care, including psychiatric emergency care. For more health information or to view this episode again, visit hahv.org. I'm Josh Ratner. Join us again next time for another segment of HealthAlliance and You.